Hi everyone, welcome to the channel. Thank you so much for making it the Think Nursing channel, where it's all about nursing, travel and lifestyle. And if you're new here, my name is Stacey, and I just want to say a big thank you for making it the Think Nursing platform. I wanted to start off with my podcast where I, be interviewing persons, so just to hear their story growing up, their experiences, going through college, where they're at now, as a form of motivating others. But there's another section where I want to just share, a really good, like a one-on-one talk with nurses, just sharing the good, the ugly, and the bad side of nursing, just so persons can hear what the day in the life of a nurse looks like, and this will also try to encourage persons and motivate them, and just kind of give others insight into the field of nursing from different nurses' perspective, whether they're here in the US, Jamaica, Canada, UK, wherever you are. Feel free to be a part of the channel. I'm going to leave my number in the section, the bio section, where you can go ahead and definitely send me a WhatsApp message if it's a case where you're interested in, getting one of those recordings going where we sit down and have a one-on-one talk, and then I'll upload it at a later date. And there is also going to be a live as well that is going to be scheduled during the week, where we'll have, persons calling in, or, just sharing their story, a day in the life of a nurse. And I'll also explore other aspects, while I am talking with those persons. So I'm going to feature my first person. She is from Jamaica. She's living in the US right now in New York, and she has over 17 years of nursing experience. She's also certified as a critical care nurse, and she has a master's in business administration. So she's kind of heading out of nursing, the bedside nursing, but we're going to talk with her, and she's just going to give us an insight into her day as a nurse working in the school, as well as a psychiatric nurse. So feel free to, leave your comments below, and remember to like, share, and subscribe for more. All right, until then, thank you so much for tuning in, and I do hope to see you at the end of the video, where you'll give it a thumbs up, and you also like, and you'll also subscribe if you haven't done so as yet. All right, thank you so much. How are you doing?
I'm awesome. It's my weekend off, so I'm awesome.
Okay, good. Which state are you in?
I'm currently in New York.
New York. Okay. Are you a citizen of the US, or where are you from originally?
Well, I am currently a citizen of the United States, but I am originally from the best place on earth, which is Jamaica.
To the world. Welcome, welcome, welcome. All right. So you're a nurse. Just kind of tell us a little bit about yourself. You don't have to give anything personal, but just general. So we can have an idea of where you work in terms of, the area. And then we'll talk a little bit about, a day in your life as a nurse, just to hear what it is like.
So I have been a nurse for 17 years,
Wow.
and I've worked in many specialties. Back home, I was ICU trained.
Mm-hmm.
I no longer do ICU since I've been here, but I'm ICU trained. I've worked in the nursery. I've worked med surg, orthopedic, um, recovery room,
Mm-hmm.
critical care. I go across
You're well
all.
rounded.
Yes.
Mm-hmm. Okay, and you have your
Currently,
masters too.
yes.
Mm-hmm. Good up,
And I
congrats.
also have a master's
Mm-hmm.
in, and it's not in nursing, it's a master's in business administration,
That's it.
because
Mm-hmm.
I want to be a business owner.
Okay,
I
that's the way to go.
Yes, I want to leave behind bedside and that hierarchy, that rigid structure.
Mm-hmm.
Yes, I don't want to be doing that anymore. So I'm heading
Yeah.
in a different direction.
Okay, that's nice. That's nice. That's nice. But you have a lot of experience, and also, I know you're gonna be doing well in whatever area you branch out in. Is it gonna still be in, like, the nursing, healthcare you're looking
Yes,
in?
it's still going to be in healthcare.
Okay.
Yes.
Okay. All right.
But when I'm established, I'll call Think Nursing again.
Of course,
And I'll
definitely
tell
will.
you all about that journey.
Definitely. You want to encourage other persons out there, let them know that bedside nursing is not the end, so that's good.
No, and that's what I like with nursing in the US. You have so many opportunities. It's not about, okay, you're a nurse, in
Mm-hmm.
Jamaica, and you have to go to take a course to be level 2, and then the only other option is to become what? Sister,
Sister.
what? Yellow belt, blue belt, whatever. I don't know.
Frill hat.
And then and frill hat, yeah, and matron. I mean, there's not much options. You know what?
Mm-hmm.
You maybe an educator, maybe, or
You
I don't
have
even know. But there, it's very, very your scope to practice in Jamaica is very, very
limited.
limited, and
Yeah.
there's limited room for growth, limited room for opportunities. It's just very, very limited there in nursing.
Yeah.
So
And then
that's what
too.
I like here, because
Mm-hmm.
I've migrated here. When I came here, I was on the cardiac floor in
Mm-hmm.
Maine, and I left. I didn't want to do ICU, cardiac. I didn't want to do anything. I wanted to save my back, save my legs, save my body, preserve. I'm like, no,
Yeah, preserve a health right about now.
right.
Mm-hmm.
So I went into psych, and
Okay.
that's where I basically have been.
Mm-hmm.
Um,
But you say you were trained in ICU, right?
right.
So how did you like, did you always have an interest in psych or what? How did you
Not
went in?
necessarily. I mean, I've been exposed to psych,
Mm-hmm.
working at the hospitals in Jamaica. They don't really have a specific psych floor.
Mm-hmm.
So they always have the psych patients at the medicine floor, which
Mm-hmm.
I spent a lot of my time in medicine. So I was
Okay.
already exposed to psychiatric nursing.
Okay. 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 So you've been exposed to psychiatric nursing and you've been doing that for some time. What is it like, working in that, those
In
departments or
behavioral
with that
health,
population? Mm?
behavioral health,
Mm-hmm.
psychiatric nursing, it's, I would say it's awesome, but it's
Mm-hmm.
great. I mean, yes, it's not what they consider the creme de la creme of nursing,
Mm-hmm.
but I mean, I get so much job satisfaction. I like when I have my patients and they come in and, they are demented, they're not lacking judgment, poor, they're just not themselves.
Mm-hmm.
And you see through therapeutic communication and rehabilitation, they come around,
Improve.
they're
Mm-hmm.
making constructive sentences, they start taking care of their hygiene, they start relating to you properly. I mean, it's something awesome.
Yeah, that's the rewarding part about nursing. When you see that, whatever
Yes,
you're doing, you can see improvement in it. Okay.
yes.
So, when you go in, so you were working in the hospital setting, or were you working like at a psychiatric facility?
I was at a psychiatric facility for 2 years, and then I started traveling
Okay.
in psych as well when I came to New York.
Okay. So this
So,
the psych facility, is it like set up just like the hospital? Can I give us an idea of what it is like when you
all
step
right.
in?
So the psychiatric facility, it is made to host different types of psychiatric patients. So you in the hospital is more like an acute care setting,
Mm-hmm.
while in the actual psychiatric hospitals, you have different types, and it's made for longer term patients. So, in these psychiatric facilities, or the one that I worked, you have acute care,
Mm-hmm.
you have med psych, you have geropsych, you have jail transfers, you have NGRIs, which are the not guilty by reason of insanity patients,
Mm-hmm.
and they have a whole program for them, specifically designed for them. So that's the difference. In the hospital, you come in, they come in aggressive, or they come in complaining that they are suicidal, or sometimes they it's drug induced psychosis.
Mm-hmm.
And then, you do
Stabilize
your,
and
yes, your treatment is stabilized, and their stay is not very long.
mm-mm. Okay. So were you do you have to do any special course or anything in preparation
Well,
for?
um, for psych nurse, you can always do the course. Every specialty here, you could always do the course and become certified in that particular course.
Mm-hmm.
But I chose not to.
Okay.
So I just practice. I go to the hospital. When you're in Jamaica, to say you're an ICU nurse, you have to be ICU trained. Once you're here and you are doing psych for a couple of years or months, you say you're a site nurse. If you're an ICU for working for some time, you say, "Oh, I'm ICU." Everybody, "Oh, in the ER, oh, I'm ER." It's not like Jamaica where you have to
Be
sign up the paper,
trained then.
go to matron. Yes, be refused by the
Multiple
matron.
times. Yes, okay.
Yes,
Yes.
so that's what I'm doing currently.
Okay. Okay.
Yes.
In terms of like, say for example, like if you're doing like medication management or, any of those, like for admissions and all, kind of run us through a little bit about,
Um,
the process.
day. Okay, so for the day shift, normally you get to work and you get your handoff,
Mm-hmm.
you get your report, and normally I medicate my aggressive patients or the patients I know might be a problem.
Mm-hmm.
Yes, those I address those ones first. And then doctors rounds, the orders come in and you do your medication management. Um, Labs are done as well. And then for the most part, they eat their breakfast. You do group therapy because you have like a creative arts therapist who comes and does the group therapies with them.
Mm-hmm.
And they have the social worker who comes and addresses these issues as well.
Okay.
Right. And for the most part, you might have medication at 12 o'clock, and then this is for a 12-hour shift.
Mm-hmm.
Um, and then by 6 o'clock, you give them their evening meds. Occasionally,
Mm-hmm.
you might have a patient who might need some restraints, which is
Mm-hmm.
not very often. They have a system where you call a code, and the hospital police comes, the doctor comes, other staff members come,
Mm-hmm.
and that's how no one person takes on a psych
No,
patient.
that's
No, we don't
challenging
do
and
that.
yeah.
Yes.
So in terms of like the rooms, because if those patients, it's a psychiatric population we're dealing with, regarding the rooms, how are those rooms different from the regular, hospital room?
Oh, well, the psych floor in itself, it's different from it's a locked unit. That's the first thing.
Okay.
Um, you have keys and fobs to go everywhere.
Mm-hmm.
So the psych patients do not go in the nurses station. They do not go in the lunchroom. They can't go through the door. You have psych aides or BHAs, behavioral health associates. Somebody's always at the door as well. But you use a key or a fob to get in.
Okay.
When these patients get to the unit, we give them clothes. We give them a special toothbrush with a short handle. They get special shoes with Velcro, nothing with laces. We give them mini mouthwash, mini toothpaste.
So quick
So
question.
nothing that they can
Harm themselves or anybody else with?
right. And we don't have, when you're on the regular floor, you have hand sanitizers at everybody's room door.
Mm-hmm.
That's not allowed because they'll drink it.
Oh.
So yes, especially if they're alcoholic, because I worked on the detox floor as well.
Mm-hmm.
Alcoholic patients drink sanitizers and mouthwashes. So
Mm-hmm.
no.
Okay.
Yeah. So and when their clothes comes from the ER, the bag is stapled, so we just put it in a room. They cannot go in this because sometimes they might have contraband.
Mm-hmm.
So they're not allowed to go in those bags until they're going
They're
home.
this okay. So in terms
Yes.
of the bed in those rooms, are they like, some kind of
No,
special
they
bed?
can't be moved. I think they're screwed to the floor.
Okay.
And the
Okay.
mattress is not like a big, heavy mattress where it can harm or suffocate somebody or cause any form of danger. So when you're in psych, it's safety, 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 safety. So, on the med floor, you have a lot of um, lines, drains. We don't have any of that on the psychiatric floor. If an emergency happens, we call a code or we call 911
Mm-hmm.
and they come because we can't keep IV lines and stuff like that.
Mm-hmm. So you do a lot of like I am shot in the muscle?
Depending, because sometimes, like when you call the code, sometimes they agree. Sometimes they agree to take the PO tablets as well.
Mm-hmm.
Here in the US, when the patients they refuse, yes, psychiatric patients can refuse medication. They do refuse medication.
Okay.
Yes, and if they continuously refuse it, then they are referred to the court. So they have to go to the judge, and the judge now makes a decision
Okay.
whether they take the medication. Yes, so at that point, we have court ordered medication,
Okay, because I
and
was
they
about to ask, just for
yes.
persons, is it a case where they physically go to court or it's just a court order? But I
So,
think you answer.
so yes, they go to the court. So there's like a court for them. So
Okay.
like a judge will come and one of us, like one of the psych aides or the when you're going over to the court, the hospital police comes. You
Mm-hmm.
call the hospital police to accompany you along with the patient
Okay.
to the court.
Okay. I remember when I was working in Maine, we had something similar like that in the hospital where if, you need a court order, the hospital had someone on standby that is available for anything like that.
Yes, yes.
Okay, okay. So in terms of the walls in the room, is it like a regular wall? Because, you have a lot of patients who will do punching and, start it in
Regular
themselves.
walls,
Regular
regular
walls?
walls, regular
Okay.
walls,
Okay.
regular walls, but the chairs are different. The chairs, they're called like sand chairs. They're very, very heavy, like
Okay.
extremely heavy. It's
Mm-hmm.
not easy to pick them up and throw them.
And throw them. Okay.
Yeah, so they don't give you anything that you can really like. Even when they're serving like dinner, the dinner trays are more like some cardboard like material.
Styrofoam kind of.
Yes, something, yeah, nothing that you could slap somebody with, or you break it and you get a sharp edge.
Mm-hmm.
No, they don't get anything like that. I've
Okay.
worked at one of the hospitals. It was so strict that they don't give, um, most of them get like a water jug, but they don't let them get water jugs at this particular hospital. We, the nurses or the BHAs, we serve them water in mini cups because they
Mm-hmm.
say if they give them the big jugs, like the gray or the pink jugs,
Mm-hmm.
yeah, one of those containers. We don't give it to them for their ice jugs because they say they store pee and stuff in there.
And then we'll
And
throw it. That's the
right.
last thing you
Or
want on your
normally when you're
shift.
on when you're on the floor and a new admission comes and you give them their bucket with their rag and their stuff.
Mm-hmm.
No, that doesn't happen on the psych floor either.
Okay.
No, that doesn't happen.
So, I know you said that you have like, occupational health and all of those persons come in, to see them. Do they see them individually or do they have them in like groups when they're seeing them? So please remember to go ahead and subscribe to the channel and turn that notification bell on. If you're loving the content, go ahead and give it a thumbs up. I'm hoping to get 1,000 thumbs up from this, which means I'm hoping to get over 1,000 views. So go ahead and give it a thumbs up. If you're loving the content, go ahead so I can know that I need to post more. All right, so continue watching the video and remember to leave your comment below.
Right. So when they come in for groups, normally they want them to be in the common area, you know?
Mm-hmm.
Nobody's really going to anybody. This is psych. We don't really go into anybody's rooms like that.
Okay.
If I'm the nurse and I'm going to somebody's room, I have to have like another nurse or a BHA with me.
Okay.
It's never just me going to a patient's room.
Okay.
So normally we take them to the common area and we have meetings. If something specific or it's a special, or if doctor put in like a special order for them to have some one-on-one, if it's a special case, then that's different.
Mm-hmm.
And then they have special rooms wherein the doctor or the BHA or the creative arts therapist, whoever it is,
Mm-hmm.
we don't go in their rooms. We take them to the room, to a special room, and that's where we have those meetings.
Okay. Because I remember when I was in Jamaica, up by the university hospital, when they had, their group sessions, the patients, well, no patient is usually left in a room. They will normally come to the common area and then they'll have group sessions with them. And then when it's
Right.
time for sleep time, they'll go back to. Okay. So basically, so I know you say you have like behavioral aids. on the floor,
Hmm.
nurses, techs. So how often do you see like a security officer or police officer like walking around just randomly? Is it only a case where they show
No,
up
they
for
come to the
codes?
floor and they come to the floor and they check.
Okay, so they
So
have
you
random
call them
checks.
when you need them, and they'll come and do their checks.
Okay, but they don't do random checks like, like every hour, every 2 hours, just check in.
Not every hour, every 2 hours, but they'll come. They'll come for every shift or
Okay.
twice for the shift.
Okay, okay.
And then if you need them, they're right there.
Okay, okay. So I know you say you did other areas in nursing as well. What about which other area you spend a little bit of a time in, if you want to share?
Now, currently, so that's my hospital job. I had a baby. So,
Okay, congratulations, ma'am.
hi, thank you. So I took a little break and I ended up doing school nursing.
Okay. That one is pretty new to
So,
me, so let's hear that one.
so normally when people think about school nursing,
Mm-hmm.
they think it's just an office-based school nurse.
Mm-hmm.
But school nursing in New York, I can speak for New York because this is where I've done it. I haven't done it in any other state.
Okay.
In New York, you have one-to-one school nursing, the office school nurse, and the transport school nurse.
Okay.
So the one-to-one is where you go to the classroom with the child and you stay all day. So that child might be a diabetic that you have to give insulin, which is my current case, or that child might have seizures. So in case anything happens, you have to give the child medication, or some of them have trachs, some have vents, have asthma problems. It just depends. So some of them are one-to-one cases and you stay all day with them. Transport, you just go on the school bus with them to make sure that everything is okay. So in case like you have a seizure patient
Mm-hmm.
and something happens, you're there to administer medication, activate the protocol, call 911, do the whole um do everything on and make sure the patient is safe.
Okay.
So that's transport nursing, and you can have a transport and a one-to-one, because if you can pick up the child from home as transport and you stay with that child throughout the day. So your transport and one-to-one for that particular child. And then you have office school nursing where you deal with everybody for the school.
Okay. Well, that sounds pretty nice. So, do you get like a salary or it's like a per hour, per patient? How do they go about
You
with
get
that?
paid per hourly. So it
Okay.
just depends. Yes.
Mm-hmm.
So my hours are like 8:30 to 2:50, just say 3 o'clock.
Mm-hmm.
Yeah. And I get paid like $75 an hour to stay in the classroom.
Well,
you know?
that's what job is paying that in nursing right now to do that. That sounds good. Mm-hmm.
And it's awesome. I deliver insulin maybe once or twice a day. I might check a ketone,
Mm-hmm.
and that's how my day goes. So I sit and watch the kids just doing art and
Work.
sleeping.
Okay. Okay. Pretty
Yeah, just
interesting.
yes, it's very nice. I can't complain. It's one of my
Yeah.
best jobs ever.
Mm-mm. If you're doing nursing for 17 years and everybody know that nursing is a very, it's
Yes, so
very
it's
tedious.
very yes,
So
this is good. It's still yes.
getting the change, the work environment and
The
this
pace,
kind
the
of less,
pace.
less work and more money. Anybody would
Yes,
want
the
that,
pace is yes,
definitely.
the pace. The pace
Mm-hmm.
is it's good. I mean, you don't want to do the heavy stuff every day, all day.
Mm-mm.
While you're doing transport nursing, you get paid for the hours. I guess it depends on the distance. So sometimes it could be 4 hours, 5 hours, 6 hours,
Mm-hmm.
and it's like $85 an hour. And in between,
Mm-hmm.
you get paid while you're not at school, so you still get paid for that 6 hours as well, basically.
Okay.
Um, yeah. So when you drop that kid off the school bus, you can go home and sleep.
So you have a lot of
You can go run
flexibility.
errands. You can go do. a home care case, if you're into home care, you can go and do some blood pressures, go
Mm-hmm.
and check your home care patients, and you have all that time in between until school is over.
Okay.
So, I mean, yeah, there are other options
Mm-hmm. Of making
besides
money.
hospital and
Mm-hmm.
yes. So,
Okay.
and it pays, you know?
Yeah, that sounds good. So my other question is, so do you have like a medical bag that you bring home? Do you always have that, or is it the case when you're going, when you go to see the patient, there is a medical bag with each patient that
No,
you, with your medications and
the
all?
parents, all right, the parents, in my case with my diabetic, my the parent
Mm-hmm.
has a bag, or she gave me that bag with a manual blood glucose machine with the patient's insulin pen and the alcohol strips, the ketone check, what else is in there? The needles.
Mm-hmm.
And if in emergency, if her blood glucose is too low, I give her some glucagon. It's there as well. And I don't take that back home. That bag stays at school. So in case I don't go and I need a coverage nurse, the coverage nurse would go and get that bag.
Okay. So
If
your
you do it on the
start.
school bus,
Mm-hmm.
when you collect that bag from the parent, you drop it at the school. And when you're going to pick them up, you take it back from the school nurse. So you're just when you're doing transport, you're just a transport nurse because there's an actual school nurse. So you give
Okay.
it to the school nurse, yes,
Mm-hmm. Okay. That makes
and you
sense.
pick it back from the school nurse when you get there.
Okay, because I was just wondering if you have different patients with different, diagnosis and treatment, having one bag is gonna be a little bit technical because you're not gonna have
No,
everything to meet the needs of everybody else. I was just kind of
no, no, no.
wondering.
If you have your 1-to-1, as I'm saying, your 1-to-1 is different from your whole office nursing. When you're in the school office, you have stuff designed. So if patients have their specific medications, because you have to go by a medication administration form. In school nursing, you can't give kids nothing.
Oh,
Not even Tylenol, not nothing. And you
okay,
always have to call the parent.
okay.
Right. And you don't do any examination of the patients and stuff like that.
For
I
school
wouldn't say
nursing?
examinations.
Mm-hmm.
Right. Let me tell you to be specific. You cannot touch above the knee, so you can only touch below the knee and above the elbows technically.
Okay,
You below the elbows. You're not supposed to lift anywhere or anything like that.
and that's for school nursing,
Right. So if anything major happens, if they're playing sports and you have concussions and stuff, you assess
definitely.
for
Mm-hmm.
your GCS and your head injuries, and you do that, but you can't just touch them and lift their clothes, and no, you don't do anything like that. Anything happens, you call the parents, you call the Department of Health, you call whoever is responsible at DOEA, tell them what's going on, and there's a lot of forms to fill out as well.
Okay.
For yes.
A lot of times I tend to see them in the emergency room, and sometimes I would be wondering, okay, then the school nurse sent you for this, but
Yes,
now I'm
but we
kind of
can't. No, they
understanding.
can't. You can't do anything. So when you do the school nurse training, because the company trains you, they train you for everything. So it's just depends on what you choose to do.
Okay, okay,
Yes.
okay. So do you think you with your job right now, do you feel like you lose any of your skills that you normally, would normally do, or you
Well,
just think
I
that once.
mean, in nursing, they say if you don't use it, you lose it, right?
Hmm. And then there's another saying that if you already, learn it, you can't lose it. So.
I think if you're not practicing
Mm-hmm.
some things, I haven't passed a core track or with an NG tube. Let me say NG tube, because
Mm-hmm.
everybody not might not say core track.
Portrait. Mm-hmm.
I haven't passed an NG tube in about 6 years now. I don't know
Okay.
if once
Uh-huh.
before when I was on the surgery floor or the medicine floor, I could do it
Um,
like I could close my eyes
in
and
a
do it. I don't
sleep.
know if I could close my eyes and do it no. You know
Mm-hmm.
what I mean?
Mm-hmm. Yeah.
Yes. So or I don't. in psych or in school nursing, we don't take blood, we don't do blood draws, we don't do anything like that. So I don't know if I stick the patient now, if I stick him once or twice, if I would get it,
Mm-hmm.
you know?
Yeah. Yeah.
So
It's
these
just
things, but I'm really not concerned because I'm not heading in that
in.
direction in nursing anymore.
Mm-hmm.
Yeah, that's
Okay.
not where I'm heading. So
So whether or not you gain
I'm
or
not
lose,
concerned.
your ultimate goal is to step outside of the hands-on aspect of nursing and head into,
That's what the young nurse is.
leave
I'm
that
getting
for.
old now.
Okay. Okay. So, so what can you say to like a new nurse out there or somebody who is having a rough day out there, thinking about, whether or not they should come in nursing or whether or not they should still stick around in nursing? Is it something that you would recommend them to look into?
Nursing
Mm-hmm.
is an awesome field,
Okay.
and I will stand by that forever.
Nice,
What
nice.
I will say is that find your niche,
Mm-hmm.
because after you do bedside nursing for a while, it becomes tiring, it is hectic, and your body is, you are a wreck.
Exactly.
So, what I would encourage young nurses is to find other options that are available to them
Mm-hmm.
and try to branch off or do other things in
That's
nursing.
that's true.
So you get your experience, have an understanding of what it is, have an understanding of body systems, have an understanding of what is happening, what medication would work, why is this medication not working, why it is that textbook is not standard, medicine is not one size fit all. They tell you something at school, they teach you something, and when you come out,
Mm,
it's something totally different. You have to
mhm.
learn these things, the
Yeah.
whys, the hows, and then you move on and you build from there.
Yeah.
And yes, you're gonna have bad days, you're gonna have rough days, you're gonna have hectic days, you're gonna be drained.
Mm-hmm. Mm-hmm.
But then there are the fulfilling days and the fun days,
Yeah.
and days when you are just so satisfied, you have some job satisfaction, you know?
Yeah. Yeah. There's some reward with it. But as I always say, once you have a love and a passion for it, you can never go wrong with it. But at the same time, as I say, find your niche and just make sure it's just something that, you definitely want to do.
Yes.
Yeah. All right. So, okay. So I want to say a big thank you for, sharing a mouthful, of information here regarding two areas that I never really knew much about. And I'm sure other persons, are not familiar with a lot of things that you had shared. They probably hear that, oh, I'm a psych nurse, but they never really know much about it, like that, especially in New York. So I want to say a big thank you for tuning in. And I do hope that I will get a chance to hear more about, in the
My
future
future
when things have
endeavors.
kick off and all. And then I know you have 17 years of experience. So I definitely want to hear a little bit more about your Jamaican experience in ICU or, with
Oh,
other, yes, other areas in nursing that you've explored so that we can just encourage other persons and just share a little bit more information about nursing in different parts of the world. So yeah. So thank you so
okay.
much for tuning in.
All right, you're welcome.
So there you have it with our presenter giving us, a day in the life of a nurse. If you want to be featured on this, please go ahead and send me a message on Facebook at ThinkNursing, and you can also send me on Instagram at ThinkNursing1, or you can leave it in the comment below and I will reach out to you. I'm going to add my number as well to the comment section where you can go ahead and inbox me or WhatsApp me on that number, so that way, you can be a part of the channel here where we can chit chat. Also, there's going to be a live that I'll be featuring where I'll be sitting up waiting for persons just come ahead and share their story. So that way we can all be a part of this thing live and direct, one-on-one with that. that nurse. Until then, thank you so much for tuning in, and I do hope that you will have a wonderful day.